Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele, presenting Health Equities Teacher module, Creating Health Equity for Women. The objectives for this module is that by the end, learners will be able to recognize actions healthcare providers can take at both the provider, patient, and systemic levels to create health equity for women. So we started the Women's Health Equity Unit by talking about healthcare disparities that they face, what makes them vulnerable, and then we looked a little bit closer at what barriers they face to achieving reproductive justice as a population. And this module, like I just said with the objective, is that now we are going to take a look at what we can do as healthcare providers to make a difference for females across the nation. And the first step in that is addressing the underlying problem, which is creating social and economic justice for women. Women's position in society has to be improved across both racial and economic lines in order to fix the health and healthcare disparities that exist between men and women and between women of color and white women, as the disparities are rooted in social inequity, social determinants of health. Nothing will change unless we fix the root of the problem at its source. And how can we do that as providers? That's a huge task, and it's easier said than done. But as providers, we can advocate for socioeconomic justice by supporting policies that address those social inequities, like, for example, equal pay for equal work. This means reaching out to your elected congressmen, your state legislators, using your role as a provider and that professional experience that you have to advocate for these populations. Additionally, on the patient level, you can work with your patients to address their own various social determinants of health. So what they might be uniquely facing, whether it's food insecurity, transportation issues, poverty, homelessness, all these social determinants of health that you have the power as a provider to assist them with, you should do so to help that individual even their playing field and reach health equity as an individual, as well as working systemically, advocating on the larger scale. Another way you can create health equity for women in the United States is to advocate for more women providers. We see that many women patients prefer their providers to be women. This is because it's associated with increased patient comfort levels. Patient may be comfortable with the sensitive topics and sensitive exams that occur if their providers are females as well. We also see that women providers spend more time with patients, converse more with them, and appear to listen more closely. And this leads to greater patient satisfaction with female providers with female patients. We also see that female providers are more likely to perform appropriate preventative service or preventative health screening and counseling for female patients than male providers. So if we can increase access to women providers through systemically with greater female admittance to medical school, female placement and residency programs, and processes like these, and that will give patients a greater access to women providers. A study found that only 12% of department leadership positions were held by women, which is problematic because over half of our population are women overall, so this is disproportionate. And having female providers in healthcare leadership, not just at the provider level, but at the leadership level, can assure that women's health issues are being equally represented in that practices or hospitals' policies and practices in order to increase equity for women patients, as well as increase access to women providers for female patients. Another thing that you can do to increase health equity for women, specifically increase their reproductive equity and reproductive justice, is provide a spectrum of family planning. Now, family planning refers to the general idea that females are have the right and power to plan their family, whether it's that they want a family at that point, that they want to have children, or that they don't want to have children at that time. So providers are responsible for helping their patients reach their current health goals, whether that is to prevent a pregnancy at that time or achieve a healthy pregnancy at that time. So as a provider, it is your role and responsibility to make sure that that happens. And that includes preconception counseling and health management. So making sure that your patient's general wellness and health are up to date, that all preventative measures are taken in terms of like reproductive cancers, health management. General wellness is all encompassed within this health management in the preconception phase. You should also be routinely and appropriately addressing contraceptive health needs based on the patient's values, preferences, and health circumstances. Every patient is unique in their contraceptive needs, and this means some may medically be ineligible for some types of contraception. Some may have values and preferences dictated by culture, religion, or just personal beliefs that prohibit them from using specific contraceptive methods. Regardless of what the circumstances are, your role as a provider is to work with that patient to figure out what they want in this moment, what they need in this moment, and then help them achieve that by finding the right contraception for them if that's what they want. And another thing that you can do as a provider to provide a spectrum of family planning is to ensure that your patients have abortion access. And this is either by providing the service yourself as a provider, if you are trained and eligible to do so, or by having other practices and providers readily available that you can refer your patients to ensure that they get an abortion if they want and need an abortion. Lastly, something that you can do to create a spectrum of family planning is to advocate. It is so controversial in today's climate in the United States about women's right to choose. And so advocate for your patients, for women that aren't your patients, for their right to health care of their choosing. So what they want in this moment, what their idea of family planning is, whether they want to be pregnant, whether they want to prevent a pregnancy, is your role to advocate for these females, as you have a specific skill set and position of power within society with the title of being a healthcare provider, and we should use that correctly. Now, on the more systemic level, we can create change. And some great ways to do that is to vote, to reach out to elected officials with your views and priorities, sign petitions, writing op-ed pieces about certain healthcare topics, educate yourself, colleagues, trainees, and staff about certain topics, and donate your time and money towards advocacy movements. So you can use all of these avenues to help create health equity for women, whether it's in terms of the health subject of your specialty, whether it's just general women's health equity, reproductive justice. All of these can be applied to women's health equity and should be done so by all healthcare providers. Now, just some examples of state legislation that we can advocate for in order to help females reach equity is prescribing and dispensing 1 year of contraceptive at once, so that they don't have to continually go to a provider or a pharmacy to get their contraception. Removing luxury goods tax on menstrual products. Mandating implicit bias training for healthcare providers to try to address and reduce implicit bias towards genders in the workplace, as well as opposing targeted regulation of abortion provider laws. Now, in the previous presentation about addressing the lack of access to abortion, I mentioned that regulations and policies at the state level can make it very difficult for providers to actually provide abortions to their patients. And that is done so through these TRAP laws. So it is our responsibility and role to oppose these and oppose abortion method bans in order to really create equitable access to abortion for all females across the country if that's what they desire. Now, those are the main categories of what we can do to create health equity, but again, there's always more we can do. So here are some smaller strategies that you can do at the individual level, the systemic level, as well as at your own practice to help create a more equitable healthcare environment for females. First, you can be aware of how women present with certain illnesses differently than men, as we discussed, how they metabolize drugs differently than men, and that they're at a higher risk for certain illnesses than men. And take that into consideration for each patient uniquely. So understand what they're at risk for, what they're at increased risk for within your healthcare specialty, and make sure that you keep that in consideration for their treatment and treat them accordingly. Additionally, you can encourage women to prioritize their health. We talked about how women frequently have competing priorities, and as their healthcare provider, as someone that they trust, you can encourage them to prioritize their health so they're able to continue supporting those that they love and the health of those that they love. Now, you can also bring healthcare services and information to community events and community locations so it's more accessible for females to get the medical attention that they need within their busy lifestyles. You can also offer complementary services at one site for multiple complementary services at one site for more coordinated care. We talked about how females typically have several providers. They might have a generalist, they might have an OB-GYN. But if your practice is providing several services, that reduces their need to then split their time and see more doctors than they need to. Practices can expand hours to evenings and weekends and allow walk-in visits to create a more accessible office and healthcare environment for females' busy schedules. And lastly, like we said, a large proportion of females between the ages of 18 and 64 have children. And so welcome children to the office, understand that your patients might be bringing children to their appointment, and welcome that because it's their reality and we have to be not just accommodating of that, but appreciative of that. So we just went over a large amount of what we can do as providers to create a more equitable environment for women in the United States in terms of health and health care. So remember that you can take actions with your own patient interactions, with your practices or hospitals, policies and regulations, as well as the advocacy you can do on the state and national level to push for more equitable policies, regulations, and practices for women's health. Thank you.